Hi, this is a quick summary of our completed USDOT UTC project, Tribal Transit Study, Demographic Needs Indicators, Funding Needs, and Livability. Tribal lands are mostly rural with low population densities. Moreover, the share of population often described as transit dependent, which includes seniors, people with disabilities, those with low income, youth, and households without automobiles, is often higher for tribal areas. Additionally, tribal areas often lack resources and are dependent on federal support to meet mobility challenges. This study provides an analysis of geographic, demographic, and transit-related data in tribal communities, with a focus on federally recognized tribes in the lower 48 states. This study also explores the concept of livability and transportation's role in improving livability. Two case studies were conducted with Standing Rock Reservation and Maka Tribe to understand the factors that residents think are important for livability, describe the quality of livability factors within these communities based on residents' perceptions, and explore how transit and other transportation factors contribute to livability. As for the geographic characteristics, reservations range in size from less than 1 square mile to thousands of square miles. In fact, some reservations are larger than some states. Many reservations are in the Midwest and Southwestern states, while very few are in the Eastern region. Population sizes vary widely among tribal areas. In general, reservations tend to have lower population densities. Most reservation lands can be described as rural, with some are small urban and urban areas. Now, demographic information on reservations, primarily concerning factors that are traditionally associated with mobility-dependent segments of the population, was studied using data from American Community Survey. In the average tribal area, 19% of the population is aged 65 or older, 24% is aged 5 to 17, 16% has disability, 27 has household income below the poverty level, and 9% are living in the household with no vehicle. Tribal areas have a disproportionately higher percentage of some of these population groups. Across the tribal areas, 28% of the population is below the poverty level, which is twice the US total of 14%. Because of lower incomes, many people living in tribal areas cannot afford to own automobile. This is especially important considering that most tribal areas are rural, low density areas with long travel distances, which makes it more difficult to live without a vehicle. Regarding the tribal transit funding, there has been progress in providing tribal transit services to meet these needs. The number of tribal transit systems and level of service has increased the past 2 decades as federal funding has increased, though the number of agencies and ridership levels have plateaued since 2015. Funding for tribal transit comes from federal, state, local, and other sources. In 2005, Congress enacted the Safe, Accountable, Flexible, Efficient Transportation Equity Act, a legacy for users, which is commonly referred to as Safety Law. This transportation legislation created 5311C, a new section of rural transit program specifically tailored to providing funding for public transportation for the Indian tribes. This 5311C formula funding under safety law began at 8 million in 2006, and it increased to 35 million with the FAST Act. To understand the importance of transportation and other factors to livability in tribal communities across the United States, the research team conducted tribal transit stakeholder interviews. 20 such interviews were conducted at workshop session at the 2019 National Transportation in Indian Country Conference in Big Sky, Montana in September 2019. Tribal transit stakeholders mentioned that from their reservations perspective, core components of community livability in the order of importance are access to jobs, affordable housing, access to healthcare services, cost of living, quality education, availability of transportation services, crime rates, broadband access, broadband internet access, and cultural institutions. The study conducted case studies in 2 Indian reservations to understand transit's role in livability and improving quality of life in tribal communities. The case study is conducted with Standing Rock Reservation in North Dakota and South Dakota, and the Maka Indian Reservation in northwestern Washington involved survey of community residents and transit riders. Standing Rock Reservation has an estimated population of 8,616 and a land area of 3,568 square miles. Maka Indian Reservation has an estimated population of 1,559 and a land area of about 47 square miles. Both have a relatively large population of youth A total of 163 survey responses were received from Standing Rock and 100 from Makar tribe. More than half of the respondents live on the reservation. Respondents were initially asked to rate the importance of several different livability factors on a scale of 1, which means not important, to 5, which means very important. Later, respondents were asked to rate the quality of each livability factor in their community on a scale of 1, which means very poor, to 5, which means very good. These figures combines the responses to the two questions for Standing Rock and Makar respondents. This figure essentially maps the importance of various livability factors versus the perceived quality of their factors in an effort to identify gaps. These gaps can help determine which factors are perceived to be important but are not in good quality in their current communities. While all livability factors could be improved in Standing Rock, specifically increasing affordable housing and available jobs, improving quality healthcare, reducing crime, and maintaining a clean environment can most significantly improve livability. Similarly, while all livability factors could be improved in Makar tribe to improve livability, specifically increasing affordable housing and available jobs, reducing the cost of living, increasing shopping and entertainment options, improving quality healthcare, and maintaining a clean environment can most significantly improve livability. Comparing these results from a previous national survey shows that the perceived quality of many livability factors is lower in reservations than in other rural or non-metro communities across the country. Please refer to the final report of the study to learn about the study findings in detail. For more information or questions, you can contact me. My name is Ranjit Kodavarti. I'm an assistant professor at NDSU. I'm also an associate research fellow with Small Urban Rural Center on Mobility, SURCOM, which is a program in Upper Great Plains Transportation Institute at North Dakota State University. At SURCOM, we provide research, education, and outreach for improving mobility in rural, small urban areas. Please visit our website for more information about completed and ongoing research projects, educational programs, and training opportunities. Thank you.